can be downright debilitating. It's hard to breathe, headaches, you don't eat because you can't even taste or smell the food, and a good night's sleep, forget about it. This next procedure can get rid of all those problems once and for all so you can get your life back. Dr. Caroline Yoon with American Sinus Institute is here to tell us how. Please welcome her back.
Thank you. Thank you for having me.
There are so many people who just think that sinus problems are a way of life and there's nothing they can do about it. Sometimes it's not so severe. They can medicate their way out of it, temporarily.
Absolutely.
But what is happening inside there that we can't see that's causing all this problem?
Just like you were referring to, I think a lot of patients, they have these symptoms for so long. It is their new normal. Right. They think this is how everyone feels, and they don't realize that they can be a completely better, newer person.
Yeah.
And what's happening in there is that you've got natural openings to your sinuses, and those openings get blocked for whatever reason. It could be from allergies, you get a cold, etc. So there's an anatomic abnormality that we're trying to fix.
It's supposed to be like a plumbing system. It's supposed to like move in and out and
exactly,
be, yeah, right?
Exactly. Your sinuses are supposed to aerate, and unfortunately in some people it just doesn't happen. So they get these symptoms. Some people don't even realize the symptoms that they're suffering are actually sinus symptoms.
Yeah, like not being able to taste.
Exactly. So it is pain and pressure in their face. I have patients who tell me my face is going to pop off my skull.
Yeah.
They get congestion in the nose. They can't breathe. They get drip. People blow out all this stuff, and they always show it to me in a sandwich bag. They get all the time. Actually, this is a true story.
And I would imagine a lot of folks too, because if you think about it, it's warm in there. It's like a natural incubation area for bacteria. So then you get the infections.
You do.
And I know a lot of times people say, "Oh, my sinuses are acting up again. I'm going to go get my Z-Pack." Well, getting antibiotics all the time is not necessarily the answer because it might not be an infection.
No, and people don't realize getting antibiotics over and over and over cause problems too. Antibiotics can be dangerous.
Yeah.
So when they're over medicated, they go to the urgent care, they go to their doctor, and they're getting medications over and over. They've gotten everything on aisle 7 of Walgreens.
Yeah.
They've got to do something a little bit more permanent.
All right, and that something is this Onrubia technique for balloon sinuplasty.
Yes.
Okay, what do you do that alleviates the problem?
So sinus surgery is not a fun surgery, and so I call this sinus surgery light. And what we're doing is that with just a light and a probe, we go in, we find the natural openings, and then we make them bigger and better with a balloon. So you can see the trauma related to this versus going in and doing a traditional where you rotor-rooter is much less.
Wow, yeah.
Less pain, less bleeding, less of everything.
Yeah, and this can be like an in-office procedure?
Absolutely. It's done in the office. The recovery is much quicker, so you have patients who can go back to work the next day also.
Yeah, and so if it's minimal tissue removal and less pain, then it's less trauma to the body,
Absolutely,
right?
Absolutely.
All right, so you have people who literally, like I said, it's debilitating. Even going to work, like you never know you're going to make a social event like a wedding or make it to work that day because it does knock you flat on your back.
It does, and I always tell my patients that sinus problems usually don't kill them, but they don't. It really causes significant quality of life issues, and that's what's happening. Patients come in and they tell me they're ready. They tell me, they're sitting there tired of rubbing their face. Only another sinus patient understands another sinus patient too.
Right, right.
And then, just speaking of 2016, we have these New Year's resolutions. We are trying to lose weight. We're trying to eat better. We're trying to, be a better person, be more productive.
I'm not going to the gym with sinus problems.
Exactly. I mean, it's true. It's true. I've had a sinus infection, and every time I jump, you feel it in your teeth.
Yeah.
So people don't realize that the balloon sinuplasty procedure can actually help them achieve these goals. When you don't breathe, when you have pain, you don't sleep. If you don't sleep, there's no way you're going to be heading to the gym.
Yeah.
Also, too, when you don't smell well, what happens is that you unfortunately make very poor food choices. You just eat to eat. So it can really benefit you on multiple levels.
Who should consider getting this? Because like I said, I know people who are constantly downing the sinus medications and they can get through that way. But that may have some adverse effects as well if you keep taking those sinus medications.
Sure, and sometimes people don't even realize what they're taking.
No, you get every symptom. You get the box that says every symptom.
Exactly,
like, okay,
exactly.
we'll take that.
And over-the-counters are meant to be used on a short-term basis. And so if you're using them for weeks and weeks on end, that means you've got a chronic issue that needs to be addressed. So patients who have recurrent acute sinusitis, so if they get infection after infection after infection, those are great candidates for it. Or people who have those chronic symptoms that we were talking about, the pain, the pressure, the congestion, the drip, the poor sense of smell, teeth, teeth pain, fatigue,
snoring,
headaches, snoring because you're not breathing well. Your wife is ready to throw you out the house.
Yeah.
These are things that it can address.
Yeah,
so.
yeah. All right, and it can be done for good.
It can. Absolutely. I mean, we are creating microfractures of the bone, and that's why they have such a long-lasting effect. We're not dilating tissue that can collapse back down on itself. We are actually making permanent anatomic changes to the face and to the sinus bones.
Now, there are a lot of people who might not have all these symptoms, but have a couple of them, so they think it is just allergies, or they think they get colds often or whatever. Yes. The best thing to do is to come in and see, because there could be a number of things happening outside of what you would use this balloon sinuplasty for, so that way you can play detective and just put all the parts back together.
I mean, let us do the work, you know. Don't let your mom or your aunt or whoever else wants to play doctor
well, Aunt Betty
decide.
said she had some tea with the chamomile in it.
Exactly, exactly.
All right, I was going to spend the last seconds here bragging on you, Dr. Yoon, because I think it makes you feel good to be a doctor who can take somebody who's suffering and then make them whole again. But another thing you do is you volunteer in Honduras addressing cleft lip and palate abnormalities in children.
People don't realize we do deal with sinuses, and we deal with everything from here to here. And so I did go to Honduras, and we did a lot of cleft lip and cleft palate work. And it's amazing. What you do realize is how lucky you are in the States versus being in another country. I remember I was operating, and I asked for a very specific type of suture, which is a string that we close. And they said, oh, no, you don't get to choose. It's just whatever is available that day.
Right.
So, you know, we've got amazing technology, including the balloons. That's something
that we have access to here.
And we have access. So we really should feel grateful for what we have here, because other people definitely don't get that opportunity.
Thank you very much.
Thank you for having me.
For more information on American Sinus Institute, you can call 713-BALLOON, 713-BALLOON, or log on to americansinus.com.